Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, October 15th, 2020 COVID update. A lot of stuff going on, very little of it positive, but I'm going to offer some suggestions tonight on what we can do as Oklahomans as we're getting stymied a little bit in some respects. So, no real good news on the Oklahoma front. We had 10 or 11 more deaths. We had 1,100 and some more cases. I think our total deaths are at, I have to look, I can't keep track of it all. 1,143. We're right now projected to hit at least 2,900 by February, or 1 in 1,000. Oh, not quite 1 in 1,000 Oklahomans. And there's absolutely nothing that the state is doing on a really organized way to help the hospitals or help anyone. So I'm going to get back to that. The country had 66,000 new cases yesterday. Texas is not the place to be, 5,500 or so cases again. Illinois is starting to pick up 4,000 cases. So there too, and then Californians and the usual suspects. Again, it's mid-October. This is when it started to evolve in Wuhan last year. It is going to evolve and prosper, unfortunately, in our country as it is in most countries in the northern hemisphere now. So why do we need to get a little more concerned is because besides it proliferating and is one thing, we're saturated in terms of hospital beds in Oklahoma. Oklahoma City has no ICU beds available. There's very little to any hospital beds in the main tertiary care centers. So Integris facilities, Mercy facilities, St. Anthony's facilities, OU facilities, Midwest City, Norman, Ardmore, all these places that have our tertiary care facilities are really overwhelmed at this point. And the problem that I'm seeing from talking to different folks, and I want to be careful because I don't want to get anyone yelled at by their administrators or anyone, but the reality is that certain very motivated chief medical officers and senior administrators in our Oklahoma City community have done their very best to try to get a coordinated plan going. There's been, I think, a really good effort from all these different facilities to try to coordinate. They've gotten the Oklahoma Hospital Association involved, who they've really tried too. But unfortunately, they're getting, we need a plan and we need some direction and we need the governor's office to take the lead. And the governor's office isn't doing anything, and it doesn't seem to be that interested. I mean, I haven't seen Stitt say anything lately. Here we're having a crisis level. We made the national news, and Governor Stitt is doing nothing. And this may offend the Governor Stitt people. I'm just observing that Governor Stitt's doing nothing. I'm not saying he needs to lock down. I'm not saying he needs to put on masks. I'm not saying any of that. He needs to lead an effort on a statewide level for the hospital systems to be coordinated and organized and have a plan and offer support directly to them, which he is not doing. And so I have a suggestion, because this is significant enough to me that it's probably time for all of us to call the governor's office. And his number is 405 521 2342. If you go online and you just put in Governor Stitt phone number, you'll also find usually the first listed thing is contact. Welcome to Governor Stitt. Email him and say you're concerned that the state isn't supporting the medical facilities, which will probably backfire with him because he won't work with anyone. And so I don't know what we do other than I want you all to remember when he runs again that he has failed us. And I'm glad again that he went out and shot the bear, and that was really important at this time for our environment, but to keep our bear population down. But perhaps he needs to be focused on having an epidemiologist that actually is medical physician who's been trained either in some medical school and has some specialty training, perhaps using some of the people at OU, public health school that offers a master's in public health, and they're extremely smart. I mean, why not use some of them? They have some obvious great people there, and I have no relationship. I'm just pointing out we have people who are really smart at OU, and why not utilize some of those people? I mean, there's the Oklahoma State Medical School, but again, I think the OU Medical School probably has a little more specialty training in this area and in infectious disease, and perhaps we need to get some other people involved. But anyway, so call the governor's office and say, hey, I'm worried. I don't want my loved one to not have a hospital bed. And what's your plan for that, Governor Stitt? I mean, why isn't there a plan? Why isn't there some, like every hospital that is can do tertiary care, why isn't there a mandated 15% or 20% beds right now need to be reserved for COVID patients when we're overwhelmed, and there's none of that in place? And the governor's office should be leading that. I mean, think about it, common sense. If all the hospitals are full and we have COVID patients being turned away and it's just starting, and then the flu season's going to hit and people with flu are going to get turned away, perhaps we need to set a mandatory level of 10% or 20% and have a coordination system in place. Since we already have one for trauma, perhaps using that one. Something, but that would take leadership from the governor, and so if he's not going to do it, we can at least let him know he should be doing it, so there won't be any confusion about his lack of performance. Now, on the other hand, if he gets involved and does stuff, I'm all aboard with him. I mean, I think that's great. I mean, he's not been very motivated on this ever, so it's just how it is. So in the meantime, since there's no leadership here in our state on a governmental level, we have to take care of it ourselves. I thank you again. We have wonderful doctors at all the facilities, wonderful nurses, wonderful administrators who are really doing everything they can. It is their focus. It is their care point for us. And so I can't say enough about the people who are doing it and the administrators who are supporting them. I think it really is redeeming, and it's special. But, I mean, some of the doctors are sick. There's hospitalists in intensive care, at least one or two hospitalists in intensive care units from COVID. I mean, they're doing everything and giving everything for these patients, but we need the governor and the governor's staff to step up as our leaders. So it's more important than ever to be on zinc. It's more important than ever to take your vitamins and fish oil and all that. Let's talk about traveling for a second. There was a paper out from the Defense Department and United Airlines, but I think it was a good paper, and it showed that air travel is actually really, really safe because of the recirculation of the air and the HEPA filters and everything. So the overall risk for infections on a plane essentially is teeny tiny, and again, it's with wearing a mask, but I think the filtration is probably the most important part, and the mask is really the second part. But we always encourage the mask. And again, there's going to be more and more information about masks. I mean, I think the primary reason for masks is they could limit spread. They may have a mild effect on preventing you getting infected, but again, it's right mask, right time, wearing it correctly. And I think there's all great variation, no matter how good you are and how good your mask is, in doing it properly all the time. So I think the mask issue, again, I'm very supportive of it, it is ultimately probably a second line therapy to the nutrition. I think nutrition is the whole ball of wax. And I would love the state to be talking about that, or putting out some public service announcements about how important it is to, stop smoking, lose some weight, take care of yourself, be on a vitamin, they should promote at least being on the RDA recommendations for all the vitamins and nutrients, and because that would help. And so that's what we really need to also be thinking about. But I think travel may be not such a dangerous thing on an airplane, at least. That's a positive. So I could find a positive. Kim, is there anything else I need to talk about other than the fact that I'm kind of disappointed that here this big pulse we're expecting is happening, and everyone's kind of doesn't know what to do. We still have no direction from the FDA and CDC. So if you ever had a question about Fauci, this is the time to think he's an idiot. Okay, let me be clear. He's an idiot. His only thing is, well, we'll have the vaccine eventually. Well, 2 months from now or 3 months from now, the vaccine isn't going to make a difference to the millions of Americans who are going to get COVID and the tens of thousands that are going to die. And so maybe we should have done something to prepare for that by going over nutrition. There's a new Plaquenil paper, and I don't talk that much about Plaquenil or hydroxychloroquine because it's so obvious that it's needed. And there's another paper I'll put out that shows just phenomenal, unbelievable results. But again, no one mentions it here because the battle's been won by the media and big pharma against Plaquenil. So that's about it from me tonight. We'll stay positive. I'm trying. Kim, anything? No. Okay, so Kim's kind of tired tonight, so I'm on my own. So anyway, everyone be safe. Again, I always say wear your masks, use your hand sanitizer, but take your supplements, take your supplements, take your supplements. I think that's key. So good night and Godspeed.